So, Joelle, let me begin with you. Access to quality health care before, during, and after pregnancy is crucial for the health of both mothers and infants. Medicaid plays a significant role in providing that care, especially for people of color and low-income families. But as they say, if you've seen one Medicaid program, you've seen one Medicaid program. So let's examine Medicaid's impact. Since a significant portion of the births are covered, what has been the effect on maternal and infant mortality in states that have adopted the ACA or expanded Medicaid and where Medicaid extends to full postpartum coverage? And has there been any impact on maternal infant health in those states that have not adopted the ACA or expanded Medicaid?
Yeah, thanks so much for that question, Linda. So just to provide some background that before the ACA expansions, Medicaid was available or was mandated to be available for pregnant women up to 60 days after birth. But that was the only requirement. And so by expanding Medicaid through the ACA expansions, now women were able to obtain Medicaid prior to pregnancy and to continue it after pregnancy in the states that expanded. And we've seen huge positive effects as a result of that. So certainly much better outcomes in those states that have expanded compared to those that haven't. We've seen it on a number of outcomes from having health insurance, including before, during, and after pregnancy, because now women are having more avenues for getting that coverage. We've seen it in health outcomes before pregnancy, which going back to something we talked about on the last panel, that, it's not just about pregnancy, right? Women's health before pregnancy matters for both when they're pregnant and for their lives overall.
Crystal, when we think about innovation and in therapeutic development or med tech, effective interventions are always disparities producing because people with resources get access to them first. So as you think about recent changes, policy changes in women's health that have been significant, that have had an impact, think about kind of where we're going in this area of sort of innovation and what the policy implications could be. How should policymakers, how should industry even respond as we don't want to innovate just for the sake of innovation, but what is the role of policy to make sure that innovation actually does reach everyone?
Yeah, such an important question. And I think the point that you made before asking the question is an important one that I don't hear enough. And that's that just because you create an innovation that improves the health of individuals, if you don't actively target and seek out and ensure that that innovation goes to those who are most harmed, then you're actively causing harm and increasing more disparities. And that's a really, really important thing to understand. So from a policy perspective, I think policymakers and innovators in the space and funders in the space need to understand that piece, that if you aren't with your funding requiring that new innovation, that new product, that new service line, that super awesome technology that saves everybody's life, if you aren't requiring that technology, that product, that service goes to those who are most harmed, then you're making things worse. So I think that's one piece. Actually, that's the most important thing, I would say. Actually, it's not. The second piece that I'll say is when innovators are creating these products and services and technologies, they need to include not just 1 or 2 or 10. They need to include a sizable number of individuals who experience inequities in that particular outcome to ensure that that innovation, that technology, that service line actually works for those individuals. Because if they don't do that, they are actively causing harm. And the third thing I'll say is because women's health tends to be funded over here as in a separate area, it's assumed that if you're funding women's health, you're addressing disparities and inequities. And that's not necessarily true because women are not a monolith. There are subgroups within women, and women's health by itself, funding does not address disparities. you need to specifically target individuals who are experiencing disparities within that women's health category in order to target disparities.